Gallagher-Burt. Karen, welcome today.
Thank you.
Karen works at the Canadian Mental Health Association, and I want to get this title right, okay? She is Executive Leader, Community Investment. That is a wonderful title.
That's a fun title.
I bet it is.
Community investment's pretty broad.
Thank you for joining us today, Karen. It is such a privilege. You came so highly recommended by Connie, and so I just knew I had to have you on the program today. So what a blessing to have you here for sure. Karen, Alberta's in a hurting place. You know it, I know it, all our listeners know this as well. And I think in some ways, I mean, not to separate things out, but this program is being taped in the Calgary area. And I live in Airdrie, and I went and met with the leader of the Airdrie Food Bank just this week, just to see how things were going. And she says she has 300 families. We had like a 28% increase, just a downturn in economy. We're doing some partnering in terms of just what's happening with that. Addiction is rampant. What are you seeing these days? Can you give us an insight through your particular lens in terms of what you're experiencing these days?
Absolutely. So Canadian mental health is having, I think, record numbers of folks coming to us. They're not all coming in crisis, but there is so much pain, and I think pain is the right word in our society right now, whether it's disagreement and argument over politics, which anyone can argue about, or it's what's happening for them personally. And I think the personal stuff is where the most angst is and the most need for support. And CMHA itself is trying very hard to create a place of welcome for anyone who's experiencing that kind of pain. And it could be mental health all by itself, it could be substance use or addiction, and it could be what we see often, the combo.
You know, I did some, in preparation for this interview, I did some research into what you guys do. I was blown away just by the sheer breadth, and not only that, the depth. For those listeners who may not be familiar, can you give us kind of a broad overview of what it is, services you offer? And what
I think CMHA, like most charities, has come out of family. Originally, and back 60 plus years ago, families had folks that were in places like Ponoka. They were in what we called asylums. And the families always knew that they had much more to offer than just their mental illness. And so CMHA came out of those families where they said, we need to create something for them. And we've evolved, and I think 2013, the flood was a big changing moment for us. We have always done supported care in combo with AHS, Alberta Health Services, for families that are struggling with addiction and mental health. We have 150 beds in conjunction with partners where we support folks. But it's the other people, it's the other folks outside of that. And the flood brought that first and foremost to our brains when, honestly, our funders turned to us and said, you've gone from 30,000 clients to a whole city. How do you support people? And so we had to shake it up.
Yeah, for sure.
Yeah.
So, you know, when you say the flood did this, in what regard? How did the flood really facilitate it?
Well, I think that was a shared trauma. And we all know that trauma is often the root of many of the problems we have with self-medication, with any substance use. It's based on trauma. And the whole city was in trauma. Whether you were impacted directly by the flood or not, it didn't matter. So what we saw was that we had to figure out how to reach out a little more broadly. We had to go out of our space and go out into community. And we've always listened to community, but we had to take it a step further. So creating our Welcome Center and our Recovery College, for example, what came out of that? Recovery College really is that place where people can come to do some self-care, a wellness journey, take some courses that might be able to facilitate a different way of thinking. And oftentimes it might even just be a stopgap for them for a brief period while they're waiting for another service. But you're connecting. And I know you talked earlier with Connie about connection. That's how we measure whether our programs work. We measure connection, we measure hope, and we measure belonging.
Wow. You know, I was looking at the Recovery College material on your website. I mean, the breadth of that, of what you're offering is absolutely breathtaking. You know, so maybe talk a little bit more about that. So what exactly are you hoping to see? Well, what is Recovery College? What's being offered through Recovery College, and how are people impacted by that?
Absolutely. So Recovery College opened first here in Calgary. We are taking it provincial. We've had a true gift for the provincial government where they've allowed us to help take it to other communities. But Recovery College really is about designing courses and the course ideas come from people in the community. We don't come up with them. All of the courses are co-designed and co-facilitated by two people, and there will be one that's a person with a background in education or academic focus, but the other person is someone with lived experience. And for us, the power of recovery is that when you have a lived experience of mental health or substance or addiction, you have a capability and a knowledge that I, as someone who's trained clinically, I don't have. I can have all the academic work and the knowledge in the background. I can have my experience of facilitating, but I don't have lived experience of substance use.
You know, not to interrupt, but I love what you're saying here, Karen, because, you know, with the guys and the girls that we work with, quite often, we have some amazing clinical people here, I mean, obviously, but quite often it's the ones who've lived it, survived it, and come through it, so I really appreciate it.
For us, that's the magic, because the empathy that they have and the compassion that they have is completely different. So our Welcome Center, our Recovery College, all of those have these folks that we call peers. And so every peer identifies either themselves personally or someone in their family has had this journey with mental health and addiction, or combo thereof. And those folks go through about 120 hours of training, and then some are employed by us, some are now being employed by Alberta Health Services, other not-for-profits, where these people with this lived experience can actually do this journey with someone side by side. So I think about the 12-step model, those kind of things, similar in that you can take the power of your experience and help facilitate a really great experience for someone else.
So how do you deliver these courses? Are they done online, or are they done in classrooms?
So currently we have about 45 courses in our portfolio right now. It does change every semester, so we will have a few different ones in January, and then we'll look at developing some new ones. They come from community. We have a location downtown on 7th Avenue and 10th Street, right by the Kirby train station, where we teach most of them with 3 classrooms. But we know that not everybody can come downtown. So we have 21 locations in Calgary where they're taught, including out in Airdrie and out in Cochrane. And we just recently have worked with the government, and we have launched a number of other recovery colleges up in Wood Buffalo, in Lethbridge, in Red Deer, and Edmonton. We recognize the power of the courses because it is something where somebody does the work themselves. Honestly, the magic happens when you have a facilitator, but we are looking at how we can take this digital and how we can go online, maybe do something with some of the technology, and that is up and coming. But right now it's all face-to-face delivery in those locations.
Now, you mentioned beds. You have 120 beds?
150.
150. Now, talk a little bit about that. What are they used for?
So we have, the group homes are all owned by Horizon Housing. We have one that we own, the rest are all run by Horizon Housing. And we have a number of beds, so 18 beds for folks coming directly out of hospital who really are still struggling and need some help, some management. So that's a partnership with ourselves, Alberta Health Services. There would be a psychiatrist and psych nurses attached, where folks are really still struggling. But then there's transitional beds where you can move into, where you have daily and overnight support, but maybe a bit more independence, and finally you can transition into independent living, where your case management really becomes your case management, and you might have someone you work with AHS that does that. So we have lots of transition there, and those beds are always full.
I can well imagine. You know, one of the concerns we certainly face at the Calgary Dream Centre is that space in between services, and I know you guys do as well. And if there's a point of grief for us, it is just hearing stories of people who get kind of lost in the midst of that.
Yeah.
You know, we certainly are seeing an increase in mental health challenges, especially in combination with addiction, co-occurring disorders and stuff. You know, you've been at this a while. What kind of trends have you been seeing, especially in the last 5 years, in terms of your clientele, society, culture? Do you have any sense of that?
Do you know, I would say that my observation has been that because we're talking about things more often, and because it's not as stigmatized, there certainly still is stigma, but it's not as dark as it was. I think that we see more clients coming in from different demographics. So often what we would see was folks that, I don't love the term, but a little more marginalized, whether they're on the outskirts of society, you know, maybe homeless, those kind of things. That's what we saw, that's what we talked about in this industry. But in mental health, and particularly substance use, we know that when you combine those two things, it's 1 in 3 Canadians that's going to experience that. So for us, what we've seen is, we've got people coming from oil and gas companies now. We've got people coming from accounting firms, professionals, where they're also struggling, and they're talking a little bit more openly about it, and they're going beyond what their employee assistance programs offer. They're saying, I need some help, and I need to take something to help me rethink about things. Maybe I need medication, but maybe right now I just want to try some things that help me, I guess, ground myself and think a little bit differently. And then in partnership with doctors, whatever, you can figure out what that plan looks like for a journey.
You know, the fracturing of families, the fracturing of relationships, but also the fracturing of people. I hear what you're saying on that.
Yeah.
So you had mentioned that you try to let your clientele shape the course offerings that you have. Have those course offerings gone particular directions over the last few years?
Do you know what's been interesting? So some of the courses that have come in based on client experience or what clients ask for, we have one that's being designed right now on system navigation. So you think about someone that's going through the mental health care system. If you are not a good advocate for yourself, it's a challenge. And all the groups do great work. Alberta Health Services, everybody does good work. But it's how do you figure out how to navigate that system and go through? So someone came to us who's very proficient at advocating for herself and said, I want to help design a course. I want to design a course on how do you navigate and how do you advocate for yourself. And so that one's in the works right now. One, of course, we have on how to get a better night's sleep. And so a much more simple methods as meditation, grounding exercises, things like that. So we'll pull in some theories that come from the psychological background or social work, which is my lens. But honestly, we let people kind of come up with what works for you.
You know, there was a jaw drop moment. Nobody can see that, obviously, obviously. But I have to say something. The navigation piece, Karen, that just blows me away. I think that's absolutely amazing. I mean, certainly in our world, one of the constant frustrations we have with people who recognize just what you said, practitioners, mental health practitioners, awesome. Yep. Awesome services, awesome people. Yes. And when I have these kind of interviews, you know, it just is kind of reiterated for me, certainly. But how do you navigate? How do you find those people?
How do you find them?
When you guys get that off the ground, we need to stay in touch on that for sure.
Well, and I know places like 211 are amazing, and 211 launched a new website. They've got all kinds of great things. But what if you don't have access to a computer?
Yeah, absolutely. Yeah, absolutely. And sometimes it can be a little bit disconnected there.
Yeah. Well, and when you're in crisis, I believe when you're in crisis, I think that your brain's foggy, and that ability to function and do the day-to-day things, let alone be your own advocate, that's a difficult one.
Can I get personal for a second?
Sure.
You know, Karen, I'm listening to you talk today, and of course people can't see your faces, although we're going to post your face on Facebook and everywhere else. But what I sense in you is passion. I sense you have a really deeply caring spirit. This doesn't seem like a job to you.
It's not.
Why?
I love the use passion. I would add 3 letters in front of it. I think it's compassion. My own experience, I think I've had a privileged life. I had healthy parents, great life. I've been married to a wonderful man for 35 years. I think my journey began when we got married, and I joke about this a lot. The only argument I've ever had with my husband is how many children to have. And I wanted 10, and he wanted 2. And he's kind of scientific, and he understood genetically how they happened. So we had a girl and a boy, and he went, well, we're done, that's all the kinds. And I didn't take a lot of convincing, but we became foster family. And so we've raised 50 children. Wow. And I went back in my 40s to become a social worker. And I wish I'd known what I know now, that Rod Stewart song, I kind of wish I could go backwards. But every family that came to me, and it was always a family, it wasn't just a child because you worked with a whole family. Every family that came to me struggled with mental health, often addiction, and also they had that trauma that kept reoccurring, and I didn't understand that then. And now I look back and see that that was every family's journey. I never had a kid that they didn't love their parents, and I never had parents that didn't love their children. What I had was families that were in trauma. And understanding trauma-informed practice has given me a different level of compassion and a bit of anger that people can't find the help they need. The other part of it is my husband journeys with depression, and he has struggled with it since he was 16, and I watch him at 57, who is a full person. Fabulous business, great relationship with our kids, highly connected in community. He's a Rotarian, he does everything, and it's still a struggle for him every day. And I want people to feel the compassion I have for folks that just some days get out of bed and that they take a step forward. And every day, it's his birthday today. Oh, and I was actually, yes, happy birthday to my Brian. And it's his birthday today, and I am so gifted at having him in my life because he's taught me how to be compassionate.
That's absolutely wonderful.
Yeah, thank you.
We're out of time. But would there be one thing that you would encourage families who are listening just to remember or be encouraged to move forward into?
So the word compassion for me is everything, and I think having compassion for your loved one that's struggling, but I think also some compassion for yourself. A really brilliant woman here in Calgary, Karen Gosby, who's doing some great advocacy work for mental health. She did a podcast with us that talked about what it means to be a caregiver, and I don't like the word anymore. I think when you're a caregiver, you give all your care away. And I think we need to be caring and care for others, but we need to care for ourselves. So personal compassion and then compassion for others goes a long way.
Oh man, I have to have you back for another program because that's a whole topic in itself.
It is indeed. It is indeed.
Karen, thank you for joining us today.
Absolute pleasure. Thank you.